Diagnosis of depression is challenging. It is an all-encompassing disorder, meaning it affects your whole body, your feelings, and your thoughts. There are several different types and subtypes of depression, which present with different behavioral patterns. Major depression is the most common. Others include bipolar disorder, dysthymia, among others. The discussion of this video focuses on major depression. A careful physical examination and medical history are usually done to identify any underlying medical conditions that may cause depression. Some medications may also cause depression. Blood tests, X-rays, brain imaging, and other specific tests can also provide more information and clarification. There are no specific laboratory tests or physical markers for an accurate diagnosis of depression. The diagnosis of depression is based mainly on the symptoms you communicate to your doctor, such as physical symptoms, daily moods, lifestyle habits, and others. Doctors refer to the guidelines in the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association, to clarify and diagnose mental illness. A diagnosis of depression is made when a patient presents with 5 of the following 9 symptoms, often during the same 2-week period, with at least one of the symptoms being depressed mood or loss of interest or pleasure. The 9 symptoms are depressed mood most of the day, nearly every day. For children and adolescents, this can also be an irritable mood. Loss of interest or pleasure in most or all activities, which is known as anhedonia. Trouble sleeping, or insomnia, or sleeping too much, known as hypersomnia. Change in appetite or weight. Sluggish thinking and movement, or restlessness and agitation. Fatigue or loss of energy. Thoughts of worthlessness or guilt. Poor concentration. And recurrent thoughts about death or suicide. Depression is also commonly diagnosed alongside other medical conditions, such as anxiety disorders, such as phobias, obsessive-compulsive disorder, panic disorders, and post-traumatic stress disorder, psychotic disorders, such as schizophrenia, personality disorders, substance-related disorders, such as alcohol abuse and drug abuse, eating disorders, such as bulimia, anorexia nervosa, or binge eating disorder, sleep disorders, such as insomnia and obstructive sleep apnea, central nervous system disorders, such as Parkinson's disease, multiple sclerosis, and Alzheimer's disease, endocrine disorders, such as Addison's disease, hyperthyroidism, and hypothyroidism, chronic medical conditions, such as cardiovascular disease, cancer, obesity, and diabetes, among others, and infectious and inflammatory diseases, such as mononucleosis and lupus. Stephen is diagnosed with major depression, also known as major depressive disorder or clinical depression. Depression diagnosis is often rated as mild, moderate, or severe based on the number of symptoms that the patient presents with. In most cases, these symptoms cause significant impairment in a person's daily functioning. In Stephen's case, his diagnosis is mild to moderate depression.